Welcome viewers, let's start our bulletin with our top focus this hour. It's 2023 and girls are still missing school due to menstruation. Now, why you ask? Well, because there's a lack of water, soap, toilet doors and overall sanitation facilities in schools across the nation. Now, this was among the many glaring findings brought to light by a report that has been now published by NGO Sulabh International. Now, according to this particular report that we are tracking, it is a forced choice for schoolgirls to stay at home during their menstrual cycle as they are fearful of using school toilets. Now, this fear has also caused the Indian girls to miss up to 60 school days or even attend half-heartedly. Now, over 4,800 girls from 14 districts across 7 states were interviewed by the NGO, and in fact, to ensure a more robust participation of women in education and employment, the report has suggested building separate toilets for girls with running water through proper tap connections. Right, this is a major issue that we are tracking, and we'll of course be discussing this in detail. And joining us on the broadcast to discuss more on this is Ms. Nirja Bhatnagar, who's the National Director of Program and Advocacy at the Sulabh International, and also Alankrita Pandey, who's a founder and managing trustee of the Titli Foundation that provides a hygienic and economic period solution and also awareness of sustainable menstruation. Nirja ji and Alankrita, appreciate you joining us on the broadcast. A very significant discussion this. We also talk about a lot of other issues, but this is one issue that has a major impact. Everyone talks about Beti Padhao, Beti Bachao, and all other slogans that of course are well and good, but at the end of the day, these are ground issues that we also need to talk about. Let me first start with Nirja. Nirja ji, you're from Sulabh International. If you can quickly help us understand the key findings in your report, because this is only magnifying what an earlier United Nations report had said, that 23% of girls in India drop out of schools due to lack of menstruation products, inadequate washrooms, and also the absence of disposable facilities.
Yeah, thank you for having me. Yes, we did came out with our report, which was going on since last 1.5 years. And we purposely selected these 7 states and 14 districts. These 14 districts which has been selected was on, these were all aspirational districts determined by the Niti Aayog. And among those districts also we have selected the district which were lowest on the indicators count. So when we talk about that, let me first tell you that no issues if you see on human issues is exist in silos. There are multiple layers, there are intersectionality. So there, if it succeeds with because of the all the factors are working together. And if it doesn't succeed, it means that all the factors are not there. For example, menstrual, even if we supply free pads to them, but what do they do if there is no proper disposable mechanism? What do they do if their school toilet has no toilet? How do they change if there is no continuous flow of the water? So just only by supplying the free pad, I don't think we'll be able to achieve menstrual hygiene. It depends upon many things. So our suggestions are right from capacity buildings to integrating national schemes to working at the Gram Panchayat and district and block level to resolve the infrastructural inadequacy, because that is something which is coming very strongly, because infrastructural inadequacies, if it is tackled, then the family of the girls also will feel safe to send their daughters, because if their daughters are really trapped, if their school doesn't have a toilet, doesn't have a door, can you imagine what is the risk the girls are putting themselves to? And this is all because of the menstrual thing which is not been taken care. So everything has to work together. Like in our finding which has come out is that Jal Jeevan Mission should be working at every level. And let me tell you, more than urban, the issue should be looked into the rural areas, because honestly speaking, girls are all
right. Nirja ji, I'll come back to that.
Girls
this is one issue that we'll talk in detail. I'll come back to that and also discuss on what the government is doing and what are the other steps that the government that the government needs to look into as well. And I was reading your report in detail, and you've spoken about a lot of suggestions that also the government can implement to ensure that this issue is tackled. And while I was reading your report, I also came across many other reports, and I'll take this point across to Alankrita Pandey, who's also joining us. Alankrita, as I was reading more about this issue, I came across a term called period poverty. Now, this has been highlighted in various studies. In fact, these studies have been talking about the menstrual hygiene or the lack of it across India. And in the latest National Family Health Survey as well, there was a revelation that shocked me. Now, the National Family Health Survey says that 30% of girls resort to unhygienic methods due to economic constraints. So, what I'm understanding here is that clearly, even when there is awareness, even when the girls are educated, affordability still is a big barrier for schools girls in India. Give us more understanding of what you come across, the cases you come across, and also how big an issue this is.
First of all, thanks for having me. If we talk about period poverty in India, poverty in general, it's very real and it's a very real issue that's out there. But when it comes to menstruation, menstruation is a taboo in itself. Like in India, we don't talk about menstruation so openly, which leads to many other factors, such as talking about periods is something that people refrain from, and not just that. There are parts of India where practices there are certain practices that are very detrimental to the mental health of a menstruator, and an average menstruator menstruates for over 25 to 30 years of their lives, and during this period they tend to use different products like cloth pads, plastic pads, menstrual cups, and if we talk about rural areas, they use products like ash, cow dung, and whatnot. And this reflects the reality of rural India. And not just rural India here, if we talk about urban cities as well, such as Delhi, Mumbai, Bangalore, etc.
So,
People living in
Alankrita, you're
slums,
saying girls in
we
rural India use items like ash and cow dung
yes,
also?
yeah, ash, cow dung, newspapers, dried leaves, and then there are certain parts of India where women sit besides the river or sit in their room. They are completely, they are completely they are cast away from their houses. They sit in a room for the entire period when they are menstruating. These issues are very real, and the issue that we are talking about, which is poverty, and which is the fact that period products are not readily available for people who cannot afford. uh, I want to highlight a fact that pink tax is very real, and we have spoken about it many times. But the thing is, a person who is a daily wage worker, a person who earns probably 100 or 200 rupees per day, cannot afford a pack of pad which costs 200 to 300 rupees. So, and that 200 to 300
Right.
rupees pack of pads will only contain like 10-15 pads. That's all. How can we expect a person coming from a low income background to obtain like a pack of pads? That's not real, and that's a very and
Right.
menstruation
Alankrita, what
is a
I'm
problem
understanding,
that
the
affects.
gist of what you're saying is the fact that affordability is still an issue. Like, regardless of all the new technologies that have come in, it still hasn't seeped into enough to ensure that schoolgirls across, in especially deep rural pockets of India, also are able to get menstrual hygiene, education, and also some sort of a facility that will help them deal with the situation. Let's also talk about what the government is doing. Nirja ji, I'll come to you on that point. Now, back in April, the Supreme Court directed the union government to devise a uniform policy to ensure menstrual hygiene for school children. Now, there's also, you were also talking about a few schemes. There's also the menstrual hygiene scheme, there's Suvidha scheme, there's Rashtriya Kishore Swasthya Karyakram as well. In your experience, how effective has the government policies been? Because there's a lot being done on paper, but when we look at reports such as yours, it clearly shows that there is still a very, very long way for us to go.
Yeah, yeah, I totally agree. Yes, that's what I'm saying, that the government schools, although has certain benefits and have certain inadequacies. Benefits, when I say, at least the governments have started this, it has come to their mind that they have understood the need of free distribution. But then the mechanisms, that's the whole issue, the governance mechanism. There's huge leakage there, because if they are sending they are distributing the pad, but they are distributing it through Anganwadi workers, through panchayat office, through block office. Somewhere there, that strict monitoring has to happen. Some kind of a mechanism has to be developed that it reaches to the unreached people, the needy people. Because when we went for our study in some interior part of a particular state, where these PVTGs were there, like, this is primitive tribal population was there. So they are getting the pad, but that quality of that pad, no girl, at least on first or second day of her menstruation, this pad will sustain more than 2 hours. So why such bad quality? Yeah, that is one part. Second part is that this it should cost not more than 3 rupees, whereas it is they are getting it at the rate of 10 rupees each. And can you imagine a tribal community, that primitive tribal community which completely depends upon their forest resources? They can't spend 35 rupees or 40 rupees for a particular for sanitary pads. So that those leakage, the that it should be given free, the quality should be given, it should be given in time. So these leakages which we normally the gets missed out from the governance part of it has to be looked in. Maybe if they want, they can invite local NGOs, local civil society organization to look into that, so that the proper distribution and equitable distribution can happen. The most the biggest issue here is also not only equality, the issue is of equity. So yes,
Right,
I would
Nirja ji, I'd
say
like to
that
cut you
government
short
has.
there. This was, of course, a very insightful discussion. We are also talking about how deeply ingrained societal perceptions also
Yes.
contribute to this particular issue that is at large. And the discussion on that is, of course, merited. But let's quickly cut across